of the stomach. Stomach is also called the gaster or great belly, vendor from which we have the adjusted gastric applied at the structure related to the organ. Next, see the definition of the stomach. Stomach is a muscular bag forming the widest and most distensible part of the digestive tube. It is connected above the lower end of the esophagus and below the duodenum. Next is the location. The stomach is obliquely in the upper and left part of the abdomen, occupying in the epigastric, umbilical, and left hypochondrial region. Next is the shape of the stomach. Stomach is a J shape. This is size and capacity. Stomach is very distensible organ. It is about 25 centimeter long, and the mean capacity of the 1 ounce and the 30 ml at the birth, and 1 liter or 1000 ml of puberty, and 1.5 liter or 2 liter or more than an adult. External features of the stomach. Stomach is called two orifice or two opening, two curvature or two border or two surface, and two parts of the stomach. Next, external features of the stomach. Stomach having the two orifice or two opening, two curvature, two border, and two surface, and two part of the stomach. First is the orifice. Now the two orifice. First the cardiac orifice and pyloric orifice. The curvature also are the two curvatures, lesser curvature and greater curvatures. The surface also having that the anterior surface and the posterior surface. Are the two part of the stomach. Stomach can be divided into two part, cardiac part and the pyloric part. Cardiac part, this fundus of the stomach is the upper concave dome shape situated above the horizontal line drawn into the level of the cardiac orifice. That is the cardiac part. Next, the pyloric part is the pyloric antrum is separated from the pyloric canal by the inconstant sulcus and sulcus intermedius present in the greater curvature. That is the pyloric part. Next is the relation of the stomach. Stomachs are the other peritoneal relations and that the peritoneal relations. It is stomach is the lined with peritoneum and the both it is surfaces. Other lesser curvatures layers is a peritoneum lining the anterior and posterior surface meet in the become the continuous with the lower omentum. Visceral relations. Anterior surface of the stomach is related to the liver and the diaphragm and the anterior abdominal wall. Then blood supply, arterial supply of the stomach. Stomach is the right epigastric artery and right gastric epipyloric artery and gastric epipyloric artery supply the blood for the stomach. Okay. Thank you, students.